Debbie Busby Edebiri is a transformational leader in perioperative services and professional education because of her can-do attitude and passion for improving the lives of her patients. She sets the highest standards for herself and shares her knowledge so others can improve the health and quality of life in our communities. Debbie consistently says yes when asked to do more and goes the extra mile to care for her patients and team. For this and many other reasons, Debbie is the recipient of the Values in Action Award for Excellence.
The value of excellence means to me that you always do your best, no matter what, that you give it 100% of the time. Things get hard, but you just do the best you can with what you have. And I also feel like it's a privilege to be able to care for people in their most vulnerable states. And I feel like I try to do my job as though I would want to be cared that way, that I would want the way that I'm interacting with my patients and the other people that are in my work, that I would want to be treated that way.
I've known Debbie for probably 20 years or more when she joined us in the recovery room and then decided she wanted to learn to work in the OR. So I trained her. I was working full-time as an OR nurse because I knew eventually she'd need to take care of me. And Debbie is always wanting to do more and learn more. So she has taken on anything anybody asks her. She says, okay, and she does it to the best of her ability, which far exceeds what most people are able to do. And she's a wonderful soul, she's a wonderful person, she's a good friend.
She makes sure that we're all educated on the different competencies that we require. She not only works with us, but she also works with the PACU staff as well on different competencies. And she strives to make sure that everyone understands what she's teaching, and she really goes out of her way to help us all. When we have to do health streams and maybe different staff members don't catch on to say electrocardiograms, she is right there to help us with the recognition of different arrhythmias, and she'll take as much time as you need.
I really truly feel blessed to be a nurse. I don't even know how else to say it. Every day of my life, whether I'm at work or not, I get to use nursing. And it's just such a blessing to me. I feel lucky to be able to have that part of people's lives. I feel, over the 33 years, I feel lucky to have been there when people have come into the life and to be there when people leave this life. And not very many other professions get to say that. A few, but in healthcare, we really do get to be in people every stage of their life, and that's an incredible thing.
Debbie's very good at seeing the big picture, and I think Debbie's vast experience as a critical care nurse has allowed her to see what's important in a situation. So there might be chatter coming from, I need this or I need this, but she knows in reality that's insignificant at that moment because there's something else that's far more important. And in all fairness, I think of all the people that I work with, I would want Debbie to take care of me, especially in a critical situation, because she's so good at that.
She has a very thoughtful way of wording things where it's easy for other people to understand without being intimidating. She knows a lot, and jokingly we sometimes call her Dr. Debbie. But she's very caring to her coworkers and her patients, and she's always teaching. She's always educating people, whether it's at home or how to care for a patient at the bedside. She's always helping others.
I think when I'm caring for my patients, I really try to look at each patient as, I'll get emotional, but I like to look at them as God would look at them and try to be those extended arms so that that love can be shown towards them. And I try to look at them not in perhaps the circumstance that they're in, but who they are and the divinity that they have.
I know that she has at times even come in on the weekends to see patients who've had a colorectal or colon resection. She'll come in and check on them to make sure they're doing all right. She really makes us an outstanding program with the way she cares about her patients.
She's somebody I can talk to. If I have a concern, if I have a problem, I can go to Debbie and I can say, this is between you and I know that's where it'll stay. She has good suggestions, and she also listens. So if I say something that I think might benefit her or a situation, she hears it, she takes it in, and she oftentimes shares that information and will make a change or an adjustment that will use any information she receives from other people if it's something that's going to be a benefit to a patient.
Debbie is a very thoughtful friend. If you're sick at home, she always calls to make sure you're doing okay. If you need anything, she's willing to drive up to her house even though it's over half an hour away. She volunteers in the community and in the church a lot, and she helps people out. And to me, she's a special friend. I've known her for many years, and she's just very thoughtful and caring and very genuine.
I think I'd just like to be remembered as a good person and as a good nurse and as someone who made other people's lives better.